So I'd like to learn more about the specifics of what you do and how that works. Can you tell us how traumatic or stressful experiences end up being held in the body?
We experience at any point in our lives, but it happens most frequently when we're young, usually under the age of 7, that is too much for us to process in that moment. You can see why it would happen more frequently when we are young, because we have fewer emotional and cognitive tools to cope with a stressful situation or an overwhelming situation. But whenever it happens, we get hit with a situation and we don't have what it takes to fully process it, emotionally, physically. So you stuff it because that's what's required of you, to be safe, perhaps, at least emotionally safe, and in some households to be physically safe. So you stuff that energy in your body and in your subconscious and lock it away. And what that can then do is find its way into muscles and neural pathways that remember at a subconscious level that event. So that muscular structure and your neural pathways remember that outside of your awareness, in your body, in your subconscious, but outside of your conscious awareness. That then is a reminder, or it becomes a reminder for future events. Some other event, unrelated, years later, maybe decades later, will happen and trigger this unprocessed energy in your body. And it's a problem because we don't have any awareness that this is going on, so we act automatically in a response. We might act out with over-the-top anger that seems out of proportion for the event at hand when decades later. Or it might cause us to not take a course of action because we somehow have some unconscious fear of going there, wherever there is. Our body remembers, but we may not in our conscious awareness. And so that's the metaphorical way of describing how it happens. We can't process an energy, it becomes stored in our body, and then somehow it informs how we view the world and how we respond to the world that we are viewing, I should say.
And how might these energies show up as physical illness?
Well, the easiest way to think about this is, the most common in my experience, is stress. Stress, we have lots of, and you're a greater expert on the chemical situation here, but I think it's pretty common knowledge even to non-physicians like myself that stress is related to the release of a variety of hormones. First and foremost, as I understand it, is cortisol. And elevated cortisol levels are associated with all sorts of illnesses. In fact, it's hard to imagine many illnesses that it's not associated with. I've seen study after study that not only relates it to illness, but relates it to our inability to heal from injury or illness. It affects our ability to respond to injury or illness by lowering our immunoresponse system. So very serious illnesses are associated with elevated cortisol levels. You're a greater expert on that, but it's my understanding it's related to a variety of heart issues. It's been associated with cancer, and even wound healing. I think about it like a wound. At first, if you have an open wound and no bandage or clothing over it, and you touch it, it's very sensitive. So that's what I was talking about earlier. It's very sensitive, and you might respond in an oversensitized way. But then think about what happens. It builds a scar, which is tough and it doesn't have any nerve endings in it, and it's inflexible, and it doesn't grow. It's just a scar, and it can happen externally on an outside wound. It's easier to think about it that way for a lot of us. But of course, we know that this happens internally as well. Well, then what happens? We lose contact with what we're feeling. And so we're less able to respond to symptoms because we don't even notice them. If these energies leave the emotional and psychological equivalent of a scar, we don't want to feel it. That's a piece of us we don't want to feel in our bodies. And if we're insensitive to our own symptoms, we're more likely, in my mind, to leave those symptoms untreated, and therefore even the ability to catch early stages of illness before they develop into more serious illness is impaired. In fact, all along the way in the course of development of the progress of an illness, our ability to even notice what we really should be noticing if we were not scarred emotionally becomes impaired.